to Time for Health. I'm your host, Rachel Faw, and we're very glad you've joined us. We're going to talk a little bit about Medicare open enrollment today with my friend Kim Ryder and my coworker Kim Ryder. We are OSHIIP volunteers. So OSHIIP is the Ohio Senior Health Insurance Information Program, and they exist to provide assistance to seniors in figuring out all the different parts of Medicare and other kinds of insurances. And they do some trainings for community volunteers like us. So thank you for being here.
You're welcome.
This is not your first time being on the show, so I think we've talked about this topic before. But so as we're taping it now, we're in the midst of open enrollment, which is October 15th to December 7th every year. And that is when seniors have the opportunity to make changes. And those changes can be, correct me if I'm wrong, Part D, which we're going to talk about for drugs, but also for supplements as well if they
and
want.
Advantages.
And advantage plans and all that kind of stuff. Okay. Well, I went a little too far, so we're going to back it up a little bit. So tell me, we have a nice image to put up on the screen also, but tell me a little bit about the different ways people can get their Medicare, like the difference between standard Medicare and advantage plans.
Standard Medicare is something that you get when you turn 65, and it's Part A and B. Part A covers inpatient hospital care. Part B covers outpatient hospital care. Advantage plans, a lot of retirees will be offered advantage plans. They consider that Part C, so it's not your original Medicare. You still have to pay your Part B premium, but you can pick up a Part C, which covers most of the time covers a prescription drug as well as hospital and doctor benefits.
Okay, so there's two ways when so that's kind of the first decision, I guess, that a person has to make, either when they're new to Medicare or like now during open enrollment, is how do I want to get my Medicare? Do I want I would say the red, white, and blue Medicare card, maybe a supplement card and a Part D, kind of an a la carte, or a Medicare Advantage plan, which kind of lumps some of those things together?
Correct.
Okay. And now's the time to make changes to any of that during open enrollment.
Right, and for the effective date of coverage, January 1st.
Okay, so they'll have whatever they have right now until December 31st, and all of these changes during open enrollment are effective January 1st?
Yes.
Okay, so you talked a little bit about standard Medicare A and B. Go back into that a little bit. A is hospitalization.
Right, it's inpatient hospitalization, and it's a 60-day benefit period. So if you're in the hospital multiple times in a 60-day period, you'll only have to satisfy that inpatient deductible once.
Okay.
And Part B is any outpatient hospital work or any physicians.
Okay.
And there's a calendar year deductible. It was $198 for 2020. Stands to go up a little bit for 2021, but it's for all outpatient services.
Okay. And there's a premium, you pay your premium for Part B,
right,
whether you have an Advantage plan or original Medicare.
Right, and some people, if they didn't have enough quarters in, they get billed quarterly for it, or if they're through like an Ohio retirement system, such as state teachers, they're going to get billed quarterly for that. Otherwise, it comes out of your Social Security.
Okay. So if a person has OPERS or state teachers or some kind of a retirement plan that does their benefits, they need to stick with those, whatever that system is offering them?
Whatever they're offering. A lot of them are going through that VIA benefits that we've talked about in the past, and they have to stick to what may be on that list in order to utilize any stipend that they get from them.
Okay. I always have that in the back of my mind as a question to ask somebody before you make changes or anything, because if you don't use what they offer, you could potentially jeopardize, like you said, a benefit or a stipend.
I have not yet seen that happen.
Okay.
But they pay for it up front, and then if they have a reimbursable medical expense, they can get that money back from their account.
Gotcha.
So through the OPERS, there are several employers in Ottawa County that have offered to go through this process through the additional benefit.
Okay. And then, so A and B are on the red, white, and blue card, and then talk a little bit about supplemental plans.
Supplemental plans, there's quite a few that are in the state of Ohio, and it's contingent on what you want. You want to pay a higher premium, obviously the benefits are going to be better. Lower premium, benefits not as good, but they don't offer the Plan F anymore, as I'm sure you're aware. Plan G is, it pays 100% after Medicare on Medicare-approved expenses minus that Part B deductible. There's a couple other ones that are out there, and OSHIIP does have the website that we can utilize, put in the information for the patients. We can kind of give them a real-time quote, depending on what they're looking for.
So supplemental plans, we have another visual aid that we can put up, but those are also letters, which I feel is a little bit unfortunate because we have A and B, we have D,
C.
And then we have C, the Advantage plans, but then all the supplemental plans are categorized by letter.
Right.
And like you said, they cover different things. So a Medicare Supplement A will cover different things than a G or an N or whatever.
Right.
Now, I've heard you say this, so I'm just going to pick a letter, G. All Medicare Supplement G plans, whether it's from Company A, Company B, Company Z, they all have to cover...
They're all the same benefit. They're just a different company name and a different premium.
Okay. So they could shop around a little bit.
Right. And it's encouraged, that they should do that. And a lot of times people will ask, well, do you have a certain insurance company that pays better? I don't see that with those. So they want to see what the most popular one is, the ones they're getting information in the mail on, what they're seeing commercials on TV for. But as long, again, you talked about the letters, they're all the same benefits, just different kinds of insurance, or different brand names of insurance.
Right.
Yes.
Okay. A tissue is a tissue, whether it's, unless you have a preference.
Right.
Okay. Now, so they could shop around. So I have a G plan, but my premium's gone up. So they could ask their existing company if there's a G plan with a lower premium, or shop different companies.
Right, they absolutely can, but they also can look at the same company for a different plan. So say right now they're doing Plan G, which we had talked about, that they only have to pay the Part B deductible. There's a Plan N out there, and the Plan N, you have to pay the Part B deductible up to a $50 copay in the emergency room and up to a $20 copay for office visits. So, you can't compare apples to oranges on things like that. You really have to look at your health and how many times you visit the doctor. If you're frequent in the emergency room, you just have to add up all of those out-of-pocket costs to see if it would benefit you to go with a different plan.
Gotcha. And the supplemental plans, they can look online to find, we can do a comparison to kind of narrow it down.
Right.
But the end decision is theirs, and they would need to find a company, either a local company with an agent, or go online, or however that works.
Right, or they can call. OSHIIP does provide phone numbers of quite a few different Medicare supplement companies, and they can call, they can enroll online. Any questions that they have, they can get packets of information in, and we're more than happy to review that information with them.
Okay. And I am going to throw out there the OSHIIP hotline number, 1-800-686-1578, a fantastic resource to get all kinds of questions answered. We also take calls and can help people, but when I get stumped, I call you.
When I get stumped,
but
we call OSHIIP.
There, I call OSHIIP as well. So that's kind of a little bit of the standard Medicare supplements, and then Part Ds. I know we do a lot of comparisons for Part D. Those seem to change a little more intensely than supplemental plans.
Absolutely.
I've noticed premiums tend to change. I suppose they go up incrementally, but then at some point, sometimes the premiums seem to change a little bit.
We've seen that a lot already this year.
Mm-hmm. But then also with a Part D plan, the formulary can sometimes change. So my company this year covers all the medications that I'm on, but the formulary next year might be different and not cover. So we're kind of used to not having that be the case in other kinds of insurance, but Part D Medicare prescription plans, I always encourage everybody, just come do a comparison every year. It doesn't take very long.
And you think that your insurance, your Part D, is not going to change. But once we run those comparisons, you can see a considerable amount financially that it's different for them. So
so I encourage everybody, make sure you do those comparisons every year. Advantage plans are kind of the option 2. Talk a little bit about those. I mean, you said they kind of lump everything together.
Right, their benefits are combined together. They get their medical coverage as well as a prescription drug. And they have, a lot of the Advantage plans do have deductibles, but they have a flat copay for use of the emergency room, flat copay sometimes for office visits. You might have a percentage co-insurance to pay, but it's the advantage to that is you kind of know what you're going to have to pay for certain services before you even go in for the services. So that to me is the advantage. Unfortunately, the disadvantage is because people pick these Advantage plans, they're not preferred elsewhere.
There's a network.
There's a network. Yeah, they have to. The facility that you use or the physician that you use have to be in network. Otherwise, you're paying out of network benefits, which can
add up
quite a bit.
Less up front, but perhaps adds up a little bit more as you go along.
Well, and you know, they give you quotes of specialists, your primary care physician. That's all pretty straight across the board. But when you start going into a non-network facility or a non-network physician, sometimes those fees are doubled. So you really have to watch, especially if we have snowbirds. You know, if they're going elsewhere, moving out west, moving south, you have to make sure that the insurance company that you have in the state of Ohio is going to work outside the state, but typically they don't. So that a lot of people don't go that way.
If someone has an Advantage plan and they decide, I think I kind of like it better option 1 with standard Medicare Supplement Part D. They can change back during open enrollment, but it's just not that easy.
It's not that easy, but they can change back, but it doesn't always, they can't always change back. There's certain things, hoops that they have to jump through. Okay. So it's not something that they can do guaranteed. Right. Okay.
Mm-hmm. Mostly in terms of the supplemental plans?
Yes.
Typically?
Mm-hmm.
Okay.
Yeah.
So just some caution, some things to think. And that's kind of why Kim and I are here today, is to to encourage people to ask questions, seek out information. Call us at the hospital, call the OSHIIP number, which is 1-800-686-1578. Ask questions, and what might work for your neighbor or even your spouse. I think a lot of the comparisons I do, the spouses aren't even on the same plan. So just because this supplemental plan is what your neighbor has, or this Part D plan is what your spouse has, doesn't necessarily mean it's the best for you. It's based on what medications you're on and all that kind of stuff.
Correct.
Okay, just a couple minutes left. What are some, Kim's top 3 things I wish people knew or would do, or some of the common obstacles that people run into when they have to come see a...
Well, one thing, they really have to make sure that they have adequate documentation of prescriptions and what they pay for their supplements or pay for their Advantage plan. A lot of people just kind of wing it, and that's not encouraged, because in order for us to be able to do our job and help them save money, they have to make sure that all those documents are in order. So that's key, if you ask me. Second thing is you have to make sure that if you are indeed changing over to an Advantage plan, make sure that all the physicians that you see and the providers that you see are all in network.
Okay. So your therapist, your heart doctor, your family doctor,
orthopedic doctors, anybody that you see. Even if you see them only once a year or maybe every other year, you still have to make sure that they're in network, especially, again, if you're going with an Advantage plan.
Right.
So, but those are the top 2 things. I'm not sure there's a third, but those are key.
Kim's top 2 is okay too.
Yeah.
Okay, any remaining thoughts?
No, just make sure that you review everything, and again, it doesn't take much time for us to run the comparisons and offer you any information. Obviously, we can't recommend anything, but we're willing to help answer questions. And again, if we don't know the answer, we're going to certainly send you to OSHIIP, 1-800-686-1578.
You got it. I also wanted to encourage people. I think a lot of people get this Medicare and you look. This happens to be one for 2021. But there's a lot of information which kind of makes you go, I can't possibly look through this, but there's a lot of really good information in here. I think every time I open it, I'm like, oh, I learned a little something
Right.
new, so
Right.
this is a good resource.
Yeah, and the table of contents in
Yes.
the beginning is real
You
key.
can look it up.
Yeah, and so if it talks about enrollment and it tells you those pages, it gives you detailed information. So,
Thank you.
you're welcome.
All right, thank you everybody for tuning in. This is a little tidbit about open enrollment. These are just Kim's and our thoughts from our experiences of helping people do comparisons. Again, check with your provider, check with your insurance company, talk it over with your family, all that kind of stuff. But ask questions and seek out help because it certainly is out there.
Right.
All right, until we meet again, I encourage you to make time for help.